Hello, my friends. It's Dr. Sharon with Clinic Reviews. Today, I'm going to be talking about the differences between Bell's palsy and trigeminal neuralgia. All this information can be found in the Blue Book. And y'all, I'm going to be singing. Stay tuned.
Silver bells, silver bells, silver bells, silver bells. It's Christmas time in the city.
Hey, Merry Christmas. No. It's not Merry Christmas today. The song Silver Bells is going to help you remember Bell's palsy. Seven bells, seven bells. It's Christmas time in the city. Ring-a-ling. Seven bells, y'all. Seven bells. Bell's palsy. Yes, I will not torture you anymore with my singing. Today, we're going to be talking about Bell's palsy versus trigeminal neuralgia. They're both neurological disorders of the face, and they can be easily confused. So that's what we're going to talk about today. As you know, this YouTube channel is a part of the bigger Clinic Review family. Go to clinicreviews.com for our streaming service. You can get all of our videos that you see here on YouTube with no commercials, as well as additional videos that Mark has done and I have done as well. You can get those for $19.99 a month. You can also do the on-demand Clinic Review. It's the same NCLEX review that Mark does in person. And you can also do small group tutoring. One session I do every month. So, and Mark does too, and Dr. Pete does another one. So let's go ahead and get started so you don't have to suffer through my singing anymore. In Bell's palsy, which cranial nerve is primarily affected? 5, 7, 9, or 10? Seven bells, seven bells. Okay. All right. You get it now? You get why we're singing Silver Bells. No, it's not Christmas, but you're going to remember cranial nerve 7 is Bell's palsy. And y'all, you know who taught me that? Do you know who taught me that? Mark Klimek was my teacher when I was in school. He was my clinical instructor, and he taught me seven bells. In trigeminal neuralgia, which cranial nerve is primarily affected? Now, do not let this confuse you. Trigeminal, you would think it would be cranial nerve 3, but it's not cranial nerve 3, y'all. It is not cranial nerve 3. It is cranial nerve 5. Is there any way I can help you to remember it? No, but I can help you remember that Bell's palsy is cranial nerve 7. And trigeminal neuralgia is cranial nerve 5. Now, you may say, Sharon, can't you teach us about these things before you start the questions? I'm going to teach them to you as we go through the questions. That's the point of going through the questions. I'm teaching it to you as we go. Remember the Blue Book, which you can get on Amazon. The name of the book is The Blue Book. You can get on Amazon. You can get the app at clinicreviews.com if you want it. And it's facts that you need to know. Trigeminal neuralgia and Bell's palsy are in the Blue Book, and there's no questions in the Blue Book. It's just facts. And so I take the content in the Blue Book and give you questions so we can practice this together. A nurse is assessing a patient with suspected Bell's palsy. Silver bells, seven bells. Which of the following symptoms would the nurse most likely observe? So one of these, Bell's palsy or trigeminal neuralgia, one of them is facial paralysis, and one of them is extreme pain in the face. One of them is acute, one of them is chronic. So that's what we're going to talk about. So which one is Bell's palsy? Bilateral facial drooping, inability to close the eye on the affected side, severe headache and neck stiffness, or sudden vision loss in one eye. So Bell's palsy, silver bells, seven bells, is not bilateral problem. It's unilateral. In fact, when people come into the ED, they often come in thinking they had a stroke because they have paralysis on one side. There's no pain involved with Bell's palsy, y'all. It's palsy. Paralysis and palsy go together. So they can't close the eye and their face will droop. It's not bilateral facial drooping. It's unilateral facial drooping. So that's what Bell's palsy is. And the differential is they're having a stroke. And so we do all the workup for the stroke and we go, oh, I think it might be Bell's palsy. And it is an acute process. A nurse is assessing a patient with suspected trigeminal neuralgia. Which symptom is most characteristic of the condition? Well, Bell's palsy is paralysis with no pain, whereas trigeminal neuralgia, think neuralgia, neuropathy, neuralgia. Neuropathy is when you have numbness and tingling, right? Neuralgia is pain, it's nerve pain. So persistent dull ache in the lower jaw, sudden severe stabbing pain in the face, chronic headache with visual disturbance, or bilateral facial numbness. It is sudden severe stabbing pain in the face, trigeminal neuralgia. Remember your vocabulary words. Palsy and paralysis go together. Neuralgia, think neuropathy, and think pain, numbness, tingling, whatever. But it's in neuralgia, it's pain. Okay. And it's severe pain, y'all. These are people who often cannot tolerate, they can't even leave their home anymore because their pain is so severe. It's unilateral. A patient is diagnosed with Bell's palsy. Which one is Bell's palsy? 7 bells. All right, it's palsy, paralysis palsy. Which of the following is the most likely cause of the condition? Bacterial infection, autoimmune disease, vascular occlusion in the brain, or viral infection? Most common, not the only reason that someone can get Bell's palsy, but most often is a viral infection. All right. So HIV is just one of the types of viruses that can cause it, but it's a viral infection is the most common cause of Bell's palsy. And I told you it's acute, not chronic. A patient with trigeminal neuralgia, pain, neuropathy. Think neuropathy is prescribed carbamazepine. What is the primary purpose of the medication? Well, what is carbamazepine? Carbamazepine is Tegretol. Why do people take Tegretol? They take it as an anti-seizure medication. Well, what does an anti-seizure medication do? An anti-seizure medication reduces the stimulation of the nerves in the brain, right? So that you're less likely to have a seizure. A seizure is this overwhelming release of electricity, basically electricity. The nerves in the brain are all firing, right? And you have this seizure. So if you give a seizure medication, it reduces the neural activity. Well, what is trigeminal neuralgia? It's cranial nerve 5 that is basically firing. It's often compressed, and it's firing because it's compressed. And it's firing and it's causing severe pain even when you aren't doing hardly anything. You barely move your face and it has this severe pain. So why would we give carbamazepine? To manage pain by stabilizing nerve activity? That sounds like something an anti-seizure med would do, stabilize nerve activity. To treat an underlying infection? No. Trigeminal neuralgia is not caused by an infection. To reduce inflammation? It's not an inflammatory process. To prevent muscle spasms? No, it's to manage pain by stabilizing the nerve activity. So that's what an anti-seizure med does. It stabilizes the nerve activity, which is why we give Neurontin for peripheral neuropathy. Neurontin is also a seizure medication, and it stabilizes nerve activity, which is why people's numbness and tingling can be decreased when they take that, like peripheral neuropathy associated with diabetes. And so that's why these seizure meds are used off-label for other things. Which of the following is a common complication of Bell's palsy? All right, palsy, paralysis, 7 bells, cranial nerve 7. I'm just reminding you of these things. So we're thinking paralysis. There's no pain associated with this. Which of the following is a common complication? Chronic pain? No, it's not a pain problem. Permanent hearing loss. Well, hearing is not affected by cranial nerve 7. Corneal ulceration due to incomplete eye closure. Well, we know if they have paralysis on one side of the face, they can't close their eyes all the way. So that sounds like it could be the answer. Recurrent episodes of Bell's palsy. You can get recurrent episodes if you get another viral infection, but it's not common. And one of the most common complications is corneal ulceration from inability to close the eye all the way. Which of the following triggers might exacerbate symptoms of trigeminal neuralgia? Neuralgia, neuropathy, pain, overstimulation of the nerves, cranial nerve 5. So what kinds of things? Remember, people with trigeminal neuralgia are in so much pain, they become isolated in their house. Why do they become isolated in their house? Because just about anything can stimulate it. Any movement or touching of the face can do that. So could exposure to a cold wind do it, y'all? That's the reason they don't leave their house. Even a breeze, it doesn't even have to be cold. A breeze touching their face, stimulates this extreme pain. So yes, A is true. Sleeping on the affected side, well, they're putting pressure on that side. Absolutely, that can cause pain. Hot foods, yes, hot or cold foods. So hot foods, cold drinks, both of these things. Spicy foods even could do it. Brushing your teeth, yes, you're touching the area that's overly sensitive. Sleeping, I said sleeping on the affected side, but just in general, does sleeping, falling asleep cause it? No, sleeping in general does not cause it. Just that's not what causes the pain. It's sleeping on the affected side. Talking, yes. If you're talking, you're moving your mouth and you're moving your face, shrugging your shoulders. As long as you're just shrugging your shoulders, as long as it's not affecting the face, then no, that's not going to cause pain. So there are many, many things that can exacerbate the pain of trigeminal neuralgia. And if you want to hear some personal testimonies about it, go to YouTube. Well, you're already on YouTube if you're watching me do this, and just Google trigeminal neuralgia. You'll never really forget it after you do that, because you'll hear some personal testimony from people who say how painful it was. A patient with Bell's palsy, paralysis, 7 Bell's, cranial nerve 7, is prescribed acyclovir, an antiviral. Vir, if it ends in vir, that means it's an antiviral. It's prescribed at acyclovir. What is the primary rationale? To reduce inflammation, to treat an underlying bacterial infection, to manage pain, or to target a possible herpes simplex virus infection. So herpes simplex virus is one of the viruses that can cause Bell's palsy. So it's not at all uncommon to give acyclovir for a viral infection, because viral infections are often what exacerbate or cause Bell's palsy. It's not a bacterial infection. There's no pain, and it's not an inflammatory response. A patient with Bell's palsy, okay, palsy, paralysis, so not pain, paralysis, 7 Bell's, cranial nerve 7, is worried about difficulty eating, which is a legitimate thing to be concerned about. What suggestions should the nurse make? Because they're going to be paralyzed on one side, right? So they're going to have difficulty eating. Try to eat harder foods that will stimulate facial muscles. No, you can't stimulate. You just have to, it just takes time to get over it, right? So you can treat the virus to speed recovery, but it takes time to get over it. So eating harder food's not going to help. Use a straw. Well, that requires muscles from both sides of the face, so that's not going to help. Chew on the unaffected side. Well, that would be good. If I know this side is paralyzed, I can chew on the unaffected side. Avoid eating solid foods until your symptoms improve. You don't have to avoid eating solid foods. Although I will say, don't think I'm telling you to avoid eating solid foods. I had dental work done yesterday, which is why I didn't do a video yesterday. Like, the whole side of my face was numb. And, but I just was so hungry afterwards. I stopped and got a donut. I think I chewed my lip off while I was trying to. I'm like, I think I'm chewing something other than the donut. Which of the following instructions should the nurse provide to a patient with Bell's palsy regarding eye care? So palsy, paralysis, silver bells, cranial nerve 7. And regarding eye care, paralysis, so they have trouble closing their eye, right? So, all right, what recommendation are we going to give? Use over-the-counter eye drops only if irritation occurs. Wear an eye patch during the day to perfect the affected eye. Apply a warm compress to the eye several times a day. Ensure the eye is lubricated and covered, especially during sleep. All right, so let's talk about which ones of these would be helpful. Use over-the-counter eye drops only if irritation occurs. Actually, the recommendation is eye drops like tears. I don't remember what it's called, but like the tear drops regularly throughout the day, because they do have trouble keeping their eye closed. Wear an eye patch during the day to protect the affected eye. We really don't recommend that. They don't close their eye all the way, but if they frequently use eye drops, they can still see out of the eye, y'all. So if they wear an eye patch during the day, it is going to limit their vision when normally they would be able to see out of that eye. So as long as they're consistently using eye drops throughout the course of the day to keep it moist, it should be fine. They don't have to wear a patch during the day. Apply a warm compress to the eye several times a day. Warm compresses don't do anything to help. It's the eye drops that are important. Ensure Oh, y'all, I can see my bruise on the screen. I don't know what happened. I've got this huge bruise on my hand. It was like this huge hematoma, and I didn't have an IV started or anything. It's like it was huge and it hurt too. Anyway, sorry. Ensure the eye is lubricated and covered, especially during sleep. Yes, you have to make sure it's well lubricated at all times, but it has to be covered during sleep. So during the day, you keep track of your eye and how lubricated it is, and you can put eye drops in it. But when you're sleeping, you're going to be out for what 7 hours, and you're not going to be constantly lubricating it. So to put a lubricant in it and cover it at night so that it's protected, that's the time. Because if you roll over, you hit it, the eyelid isn't going to be able to close to protect it if the cat jumps on your head while you're sleeping or something. A patient with trigeminal neuralgia, neuropathy, pain, overstimulation of the nerve, cranial nerve 5. So trigeminal neuralgia is being considered for surgical intervention. So remember, this is a chronic condition. It's compression, it doesn't even have to be a lot of compression, but somewhat compression of the cranial nerve 5. And for people who can't tolerate it, the pain can be so severe, they actually have to go in and cut the nerve. Okay. So they're being considered for surgical intervention. Like, I can't handle this pain anymore. And that's not uncommon for this disorder. It's extremely painful. Which procedure involves the destruction of the nerve fibers to reduce pain signals. So they actually go in and just destroy the nerve to stop the pain. Nerve avulsion, microvascular decompression, gamma knife radiosurgery, or balloon compression. It's nerve avulsion. That's the word for destroying the nerve avulsion. So just a vocabulary word. A nurse is teaching a patient about the prognosis of Bell's palsy. Which statement should the nurse include? Most patients with Bell's palsy experience a gradual worsening of symptoms over time. Permanent nerve damage is common, leading to long-term disability. Complete recovery is possible, and most patients see improvement with 3 to 6 months. Bell's palsy often requires lifelong management with medication. So I told you that Bell's palsy is an acute condition, whereas trigeminal neuralgia is a chronic condition, which is why they have to do nerve avulsion for trigeminal neuralgia, whereas Bell's palsy, that you can expect recovery. It's going to take a little while, but you can expect recovery, and there should not be permanent damage from it. A nurse is educating a patient with trigeminal neuralgia about managing their condition. Which lifestyle modifications should the nurse recommend? Remember, this is chronic, and it does require lifestyle modifications to see if that will help before we go and destroy cranial nerve 5. Increase caffeine intake to improve alertness. Well, increasing caffeine intake isn't going to do anything to reduce stimulation of the nerve. So that doesn't sound like a good idea. Avoid triggers such as cold wind or chewing hard foods. Absolutely. And those aren't the only 2 triggers they need to avoid, right? That whole list of things that we talked about. That's why people become so isolated with this disorder, because literally anything, even a breeze, will cause severe pain. So B is a good answer. Engage in strenuous exercise to straighten. No, you don't want to be moving your facial muscles. That makes it worse. Limit fluid intake to reduce facial swelling. That you shouldn't have facial swelling. That's not a complication of the disorder. So no. So avoid triggers such as cold wind or chewing hard foods. That's something you need to do. A patient with trigeminal neuralgia is concerned about the impact of the condition on their daily life. Trigeminal neuralgia. The reason I'm going back and forth between Bell's palsy and trigeminal neuralgia is so that you pay attention to which one we're talking about, okay? Because you need to pay attention. It's a word that you need to pay attention to. So trigeminal neuralgia, neuropathy, nerve pain, cranial nerve 5. So we're talking about the impact of the condition on their daily life. We're talking about pain, right? And isolation. What is the best response by the nurse? Now, whenever I get a question like this, the first thing I look for is an answer that encourages them to tell me more about their concern. So let's see if there's an answer that encourages them to tell me more about their concern. So here's what I would say. Trigeminal neuralgia can be easily managed with over-the-counter pain relievers. Well, that's not encouraging them to talk more. Surgical options are always necessary to relieve symptoms. That's not encouraging them to talk more. You should avoid all activities that could trigger the pain, including talking and eating. That's not encouraging them to talk more. Many patients find relief with medication and lifestyle adjustments, and surgery is considered if necessary. That's not encouraging them to talk more. So it can't be, this isn't a psych question wrapped up in a med-surg question. So sometimes you'll get a psych question, like a therapeutic communication question, wrapped up in a med surg setting. And that's what I usually think of when I see what is the best response, right? And if it's a therapeutic communication question, then it's tell me more about how you're feeling. So that's not what this is. So instead, I want to pick just the best answer. Which answer is the most truthful and consistent with what I know to be true about the disease, about trigeminal neuralgia? All right. Well, trigeminal neuralgia cannot be easily managed with over-the-counter pain relievers. So I'm crossing off A. That's just false. Surgical options are always necessary. That's not true. So I'm crossing off B. That's false. You should avoid all activities that could trigger the pain, including talking and eating. Well, they do want to avoid activities that could trigger the pain, but that doesn't mean they have to stop talking and eating. I mean, y'all, that's just ridiculous that I would say that to someone. D, many patients find relief with medication. That's true. Many patients find relief with lifestyle adjustments. That's true. And surgery is considered if necessary. Those are all true statements. So I'm just going to pick the one that's most consistently truthful, what I know about the disease. All right, I know I went through that pretty fast, and that's because it's not that complicated of information, y'all. And I wasn't doing clinical reasoning here today. That's not what we weren't prioritizing or doing clinical reasoning, which takes a little bit more time to think through it. You were seeing questions where you just got to know the right answer. You have to understand the conditions. That's what we were talking about. And I hope you have a great rest of your day. Good luck on your NCLEX. Thanks for watching till the end, and I'll see you later, y'all.